Thank you so much. It's really just incredible to see everybody in the crowd today. When we started this journey back in 2019, each one of you has been a pivotal part of this journey. When I look at Erica, right, and others, I remember you showing up at my clinic while I'm seeing patients, telling me the way to do the work. And without partners like you, this would never happen. I have to just quickly make some shout outs. So I want to sincerely thank the Center for Gun Violence Prevention team that's here, the core team. A big thank you to all the survivors here as well. And to have a leadership team at a health system, right, from marketing to our CEOs involved in this issue, everyone always asks me, are you guys at risk of being cut, right? Is something happening? And I can tell you, there's been nothing but positive momentum on this topic. So it really does mean a lot to have all the Northwell leaders here. Now, one last thing, because we have a special individual in the crowd today. And I think it really highlights the power of health system interventions when it comes to preventing gun violence. James Washington, who I'm gonna have stand up in a second, is here. And he actually wanted to be here today for the first time with folks like you. He came into our trauma center in April of 2024 and was shot, lost 22 units of blood, barely survived. And to this day, every trauma surgeon in our hospital remembers James Washington because the day after that gunshot injury, he wrote a letter while having a breathing tube in, while being intubated, saying, "I love everyone." Mm-hmm. And he has been working since that day, for the last almost 2 years now, daily with one of our violence interrupters, Toynese, who's here as well, and our entire gun violence team to go to school, right? He's interested in becoming a physician. He wants to work at Northwell. So I just wanted to really, James, give you a shout out. Thank you for being here. If you want to stand up. So we have such an incredible panel here today, right? When we look across the national landscape and we see inaction, this panel defines action by far in such different and powerful domains. We're gonna kick it off over here with a basic question. So Jackie, we'll start with you. What does bold leadership in gun violence prevention for you actually look like in 2026? And just give a brief intro on yourself and what brings you to this.
Sure, absolutely. Thank you all for inviting us here. I am so grateful for all the work that you do on a daily basis. And I am the Chief Medical Officer at Epic, and really my role is to try to help elevate you as heroes and as you said, the way to do the work. I think we want to make sure that we're able to celebrate the way that you do the work and get that standardized and normalized within the system. What brings me to this work, I'm a family medicine physician by background, and in Wisconsin, actually about 70% of the firearm injuries are suicidal. And as a family doc, I'm really good at doing screenings for mental health, but I don't know that I'm as good or we normalize as much doing screenings for gun violence. And so what would be bold for me within the next year or two is to really make this standardized, normalized, just like we do with sepsis screening, just like we do with depression screening, and have it be something that we really value as a public health crisis that we should.
Love it, thank you. Kirsten?
Yeah, so I'm the editor-in-chief of JAMA and the JAMA Network, a network of 13 medical journals. And I've been in this position about 3.5 years. Journals like ours generally sit around and wait for people to send us papers, and then we reject a lot of them and publish some of them. We decided a few years ago that what we wanted to do was to actually convene and use our power as a convener to basically try to tackle some of those issues that in medicine we've come to think of as intractable. We'll never make change in these areas. And the idea was to convene thought leaders from a variety of different sectors, to get them in the room, to close the doors, no media, Chatham House rule, and say, what would it take to make change in this particular area in 1, 2, 3 years? And it was really powerful. We had our first, and we realized that people who get invited to a lot of meetings got something out of these meetings because they were talking and they were trying to actually not just talk about the problem, but talk about the solution with others who they oftentimes don't talk to about how to get there. So the last year we held our third JAMA Summit was on reducing violence from firearms. We had a great steering committee. Several of you were in attendance or helped to plan this. And it was again, very powerful. The idea here is to try to get at solutions, so that we developed 5 themes that came out of this. To network, and I'm getting a lot of hints from how you have all done this Northwell meeting, because convening is very powerful. But then to use our long tail after that, because we publish science, to publish science along these themes that were identified by this group of leaders, and that our job in the entire ecosystem is to publish the evidence. But now we know the themes, where the field is going, and to use our 13 journals to publish the evidence to help to move the discussion forward.
Incredible. And it's been huge, right? I mean, at a time when research funding is being cut, to have that academic legitimacy from JAMA has been monumental. Soledad?
Hello, everyone. I'm Soledad Adrianzén McGrath. I am the brand new program director at the Joyce Foundation for the Gun Violence and Justice Prevention and Justice Reform Program. I come to this work because I am originally from Lima, Peru. I am an immigrant. We, like many immigrants in this country, have lived through state violence, interpersonal violence, and have come to this country to build a better life. Just a basic thing. Be able to thrive and be safe, just like everybody else. And I think that is where we find the common ground. At the Joyce Foundation, we are based in Chicago. We work to advance racial equity and economic mobility for the next generation, and really focus on making the lives of the residents of the Great Lakes better. I want to acknowledge, because I have to, my colleagues who have really paved the way for me to be in this seat. Nina Vinnick, who is, many of you know, I am sure, leading the early work for the foundation in the gun violence prevention space, and my colleague Tim Daly, who is just always such a joy to work with. So I want to thank them for building that foundation. What is important, I think, is that we have acknowledged, and what bold leadership is this room, truly. Recognizing that we have all had a role to play in this work. We come to this issue with our own lenses, with our own experiences, but we all have a role to play, and we all have a responsibility to work to keep our children safe, to keep our communities safe, to help our communities thrive, and there are many entry points. And I'm really proud of the work that the foundation has done over the past several years to acknowledge that this is a multi-sector effort. It is not going to be just one approach, one strategy, and we do know a lot about what works already. So I'm looking forward to thinking about how the leadership that already exists in this room and that exists in many of our communities, in our neighborhoods, on our blocks, can be amplified and scaled over the next few years.
Amazing. And in each of your booklets, there's a QR code for an implementation toolkit, right? This is a 100-page plus document that will allow hospitals across the entire country to think about how they might want to implement gun violence prevention work. So of course, as we heard earlier, if you live in Utah, right, you might want to have more of a suicide focus. In other communities, you might want to have more of a community violence focus. So that's an implementation toolkit that was very much supported by Joyce. Mm-hmm. So thank you for that support. What blowback or barriers have you faced in kind of tackling this issue in your individual organizations? Maybe Jackie, we'll start with you.
Sure. Blowback is difficult in the sense that when you think about an electronic healthcare record system, you really need to think globally. And so we're not just thinking about the blowback that comes from this work, but we're thinking about how does that work specifically integrate throughout the rest of the person's life. When EPIC was created, actually EPIC is the name of EPIC is the dictionary definition of an epic poem, which is a glorious account of a patient's events. Mm-hmm. And I think so it's not an acronym for those of you that usually spell it with all 4 letters, 4 big letters. But truly, I think that that's what we need to make sure we're focused on, is making the idea of this is mental health, this is social health, this is housing, this is social drivers, this is all of you and who you come as a person, both as a provider and a caregiver, and also as the community that you're serving. We try to capture that in a way that then can be used and reused to try to really understand a person's story, so you don't have to ask them the same question all over again every single time they visit a different organization. So really, I see the work and the difficulty of the work being more about making the right thing to do, the easy thing to do, getting all of the information there, and being able to empower the people that just otherwise wouldn't be able to have it, and not make them forage for it.
So it's one of the largest businesses in this country. Has there been receptiveness to that?
Yes. So we actually at Epic have a work group for firearm prevention, and we have 10 different organizations that, again, we aren't the experts in this area, but you all are. And so we want to learn from you. And all of those 10 organizations have helped us to create 3 specific tools, and then more to come. One is we worked really closely with Northwell to use your screening tools and to embed those into our foundation system, which is when you use Epic out of the box, you're able to actually put that in, and you can use that screening tool in the emergency department. Second, we've also looked at reporting tools, so trying to figure out these trends that each of us keep talking about with data. There's a rich, robust amount of data within the EHR, including diagnoses that are happening during the EHR related to gun violence. So really monitoring and seeing that through. And then orders. So we could actually place an order in the system to make sure that there is a gun lock, that we actually are providing that on site. 2 in the future that I'm excited about, I would love to see existing resources on gun safety and different resources that are in the community actually be embedded in, we call it an after visit summary, which is what we give to our patients afterwards. It would be great if we could standardize and lean on the shoulder, or stand on the shoulders of all the different ones that have come before us to really just not recreate the wheel. And I also would love to we already have a lot of community referrals, but I want to make it even easier to allow all groups like you that are in the community to be something that I can, as a clinician in primary care, directly place a referral in the EHR, so that is just another easy step. I think what brings this together is, again, making the right thing to do, the easy thing to do, standardizing it, and learning from you guys.
Love it, love it. Yeah, the easier we make it, the more it's going to scale. Now, you're offering those screening questions for free, right?
The screening questions are free. They're in the foundation system, yes. If you have Epic, yes.
For anyone wondering. Kirsten, what about you? I mean, have you faced, like, organizationally, was there a concern or?
Yeah, I would say there's a lot of hand-wringing inside journals like ours that, because journals like ours are oftentimes accused of being that we should stay in our lane. This isn't our lane, that we don't want to take on issues that are political. For me, as the editor-in-chief, it's very clarifying. If this is an issue that affects our patients, if naming an issue that affects the health of our patients, that is something that our journal has a responsibility to do, and we have a responsibility to publish the evidence that helps us to think about improving the health of our patients. It's very clear, and so I think once we get over that, the concern and the hand-wringing, we actually haven't had blowback actually on having the event and publishing the science. There's a lot of, I don't want to say, just a lot that holds us back is concern about the potential. And I think once we move, if we're guided by what in our profession is the first principle, I think you can get a long ways.
Well said, well said. And Soledad, I mean, you guys have focused on this type of funding for years.
Yeah.
But have you had to pivot in language or additional considerations?
So I would say we're a nonpartisan organization, but Joyce has been at the forefront of this work when it was a very lonely space, and supporting the organizations that were willing to be partners and take the risk and take innovation to another level. So we have been steadfast in that work. One of the big significant shifts that was made was back in 2017 when the board adopted the justice reform aspect of this work. So before it was the gun violence prevention program, and then expanded to include justice reform, and that was in recognition of not necessarily blowback, but an understanding that we can have the best policy with the best intentions in place and not be thinking what the impact is down the line. And so what we were seeing is that communities of color in our neighborhoods that were already disproportionately being harmed by gun violence were also then being harmed not just by the harsh and punitive justice systems responses, but also by the enforcement, over-enforcement of sound gun policy on those same communities. So getting doubly harming communities that we were trying to help support. And so I would say, no, organizationally, we have stood by our partners and been on this fight for a long time and intend to be so.
Thank you. Jackie, can you talk to the audience here a little bit about the data infrastructure landscape, right? We have an issue with data infrastructure for a lot of our public health issues, but particular to this topic. You touched a little bit on it, but what are some of those big gaps and what's Epic looking to do?
Yeah, absolutely. So within Epic systems, there's a lot of different pieces of information that get recorded. It could be the social drivers of health, it could be diagnosis codes and so forth. And traditionally, when we think about grouping those people together and potentially de-identifying that data and using cohort data, we always want to look at the quality of the data. And as you can imagine, when you are in a primary care office or an emergency department, asking the right questions and consistently asking the right questions and the same questions over and over again is really what's going to give you robust data. And that will help with publication as well. So the idea that we're really focused on in this particular space is partnering with Northwell and others to make sure that we're asking the same questions right from the get-go, and that traditionally, when maybe we wouldn't be reporting on gun violence, that we actually lean into that and have that be part of our standard reporting as well. So both standardization and really creating the infrastructure and then scaling that across the country and the world to make sure that we can really understand the underlying data.
Awesome. Kirsten, prevention science is tough, as is implementation science, and you often can't do randomized controlled trials. Right, so how do you guys look at the rigor of that scientific evidence from a journalistic standpoint?
Yeah, I would just, I want to start by saying that I do think the evidence is important, right? It is important. We all are here because we believe in the importance of this topic. The way we continue to bring people into the room is by showing the evidence of what works and why it works. Randomized controlled trials are the gold standard, but in our journal, only about half of what the science we publish are randomized controlled trials because not every question that we have in clinical practice or in public health can be answered with a trial. We have strong culture and laws and just general views on tobacco and its harms. That was never studied in a randomized controlled trial. So we always have to have lots of types of evidence. I think one of the things that came out of the report on our Summit on Reducing Firearm Violence was on looking at the ways, the rigorous approaches that might be observational in nature to showing that an intervention works, to surveilling, to following over time, to collecting the data over time. And those are the things that are important for sustained progress in an area. And there are approaches, observational approaches to doing that.
There's a lot of conversation at the NIH right now, controversially, around reproducibility.
Yes.
Is that coming into play as well?
Yeah, I mean, I think what Jackie's talking about is really important. The data collection and then the systematic ways to look at the data are important. I want to say here, we're all so energized by the first talk this morning, which was really incredible in looking at those numbers of declines in murder rates. But we do also need the follow-up to know, well, why is that? What worked? What are the things we need to know there? That's what's going to get more people in the room, more people on board. That's what's going to make sure that we can sustain this. And that is what the evidence base, the ongoing data for surveillance, the observational types of approaches, that's what's going to further this.
Totally. Soledad, I mean, from a grant maker perspective, right, there's, I assume, even more scrutiny now on kind of those outcomes. So how do you define success with respect to outcomes for the programs you fund?
That's such a great question because it's really a conversation that we should all be having. When we're thinking about what is a comprehensive public safety ecosystem, I think we've acknowledged in this room that there are multiple levers, there are multiple players, there are multiple stakeholders. And the standards that we set for our criminal justice agencies may not be the same standards that we set for our community organizations that have a third of the resources, capacity, lack of data infrastructure, So we really have to be thinking about what are the ultimate outcomes that we're trying to meet and achieve, and how are we going to responsibly hold organizations and programs to those standards while not undermining the really important work that is life-saving and long-term work that has to happen. So we try to take that approach, thinking holistically, thinking about the role that program is playing in the broader ecosystem, and what is both an understood outcome, and what are benchmarks that we can be aiming towards as the work progresses, recognizing that it is long-term work.
Mm-hmm. And part of that is a narrative, too, what people perceive as working, right? Mm-hmm. So, we're up at time. We could speak for many hours. Parting thoughts. Jackie, we'll start with you for the audience. What do you want them to leave today with?
I mentioned 4 letters in caps before, and I'll give you another 4 letters in caps. We have a principle at Epic called the duet principle. Difficult for us, easy for them. And what I want to impart is that we can absolutely make the hard thing and the right thing easy within an electronic record, but we can't do these beautiful convenings, and that is the work that really needs to be done in addition. Let's put the stuff that should be low-hanging fruit behind us and let us work on that, and then together we can go forward.
Love it. Kirsten?
Yeah, I think one of the themes that came out of the JAMA Summit report was to change the narrative and to normalize that violence from firearms are preventable. And I think that is a very powerful framing, because it allows then for us to think about all of the ways that we study, that we develop the evidence, that we look at ongoing surveillance, that we write about this. And for our journals, that's what it is that we will continue to do. And I think for all of us, it is, and I love the conversations in the room, it is about normalizing and changing that narrative, and then thinking about all the hard work we have to do within that to keep that going.
Well said, well said. Soledad?
I think it's been said in multiple ways already throughout the room, but this notion of sustained focus, sustained attention, and sustained commitment is really key, and a broad table where we can all see ourselves playing a part, because we all have the responsibility to do so. The public dollars have to be unleashed again, because that is critical. Local level support on the public side, those resources are key. But I think, and the last thing I think I'll say is that while it is important that we have this optimistic message of agree to agree, I think it's okay to disagree also. It's actually healthy, and we can come to the table and disagree in a civil way, and that gets us to the ultimate outcome that we all want, which is to keep our children safe, to keep our families safe, and to see our communities thrive.
Thank you so much. We did have a couple questions, but we actually addressed them already. So thank you so much for being here.
Thank you.